The ketogenic diet and hyperbaric oxygen therapy prolong survival in mice with systemic metastatic cancer. Abstract. Introduction. Abnormal cancer metabolism creates a glycolytic dependency which can be exploited by lowering glucose availability to the tumor. The ketogenic diet, KD, is a low-carbohydrate, high-fat diet which decreases blood glucose and elevates blood ketones, and has been shown to slow cancer progression in animals and humans. Abnormal tumor vasculature creates hypoxic pockets which promote cancer progression and further increase the glycolytic dependency of cancers. Hyperbaric oxygen therapy, HBOT, saturates tumors with oxygen, reversing the cancer-promoting effects of tumor hypoxia. Since these non-toxic therapies exploit overlapping metabolic deficiencies of cancer, we tested their combined effects on cancer progression in a natural model of metastatic disease. Methods. We use the firefly luciferase-tagged VMM3 mouse model of metastatic cancer to compare tumor progression and survival in mice fed standard or ketogenic diet ad libitum. With or without HBOT, 2.5 atm absolute, 90-minute sessions, 3 times per week. Tumor growth was monitored by in vivo bioluminescent imaging. Results. The ketogenic diet alone significantly decreased blood glucose, slowed tumor growth, and increased mean survival time by 56.7% in mice with systemic metastatic cancer. While HBOT alone did not influence cancer progression, combining the ketogenic diet with HBOT elicited a significant decrease in blood glucose, tumor growth rate, and 77.9% increase in mean survival time compared to controls. Conclusions. The ketogenic diet and hyperbaric oxygen therapy produce significant anti-cancer effects when combined in a natural model of systemic metastatic cancer. Our evidence suggests that these therapies should be further investigated as potential non-toxic treatments or adjuvant therapies to standard care for patients with systemic metastatic disease. Introduction. Metastasis is a complex phenomenon in which cancer cells spread from a primary tumor to establish foci in a distal tissue and is responsible for 90% of cancer-related deaths. While many primary tumors can be controlled with conventional therapies like surgery, chemotherapy, and radiation, these treatments are often ineffective against metastatic disease and in some cases may promote cancer progression and metastasis. There is a substantial need for novel therapies effective against metastatic cancer. The VMM3 model of metastatic cancer is a novel murine model that closely mimics the natural progression of invasion and metastasis. The VMM3 tumor arose spontaneously in the brain of a mouse of the VMDK inbred strain and expresses multiple growth characteristics of human glioblastoma multiforme with macrophage, microglial properties. Systemic metastasis has also been repeatedly documented in human glioblastoma multiforme, GBM, which has been linked to the macrophage, microglial characteristics of the tumor. The VMM3 model of metastatic cancer has a distinct advantage over other metastatic models because it spreads naturally in an immunocompetent host, mimicking the natural cancer microenvironment. For these reasons, the VMM3 model of metastatic cancer was used for this study. Abnormal energy metabolism is a consistent feature of most tumor cells across all tissue types. In the 1930s, Otto Warburg observed that all cancers expressed high rates of fermentation in the presence of oxygen. This feature, known as the Warburg effect, is linked to mitochondrial dysfunction and genetic mutations within the cancer cell. These defects cause cancers to rely heavily on glucose for energy, a quality that underlies the use of fluorodeoxyglucose PET scans as an important diagnostic tool for oncologists. Ketogenic diets are high-fat, low-carbohydrate diets that have been used for decades to treat patients with refractory epilepsy. Dietary energy reduction, DER, lowers blood glucose levels, limiting the energy supply to cancer cells, while elevating circulating blood ketone levels. Ketone bodies can serve as an alternative energy source for those cells with normal mitochondrial function, but not for cancer cells. Dietary energy reduction has been shown to have anti-tumor effects in a variety of cancers, including brain, prostate, mammary, pancreas, lung, gastric, and colon. Dietary energy reduction produces anti-cancer effects through several metabolic pathways, including inhibition of the IGF-1, PI3K, ACT, HIF-1, a pathway which is used by cancer cells to promote proliferation and angiogenesis and inhibit apoptosis. Additionally, dietary energy reduction induces apoptosis in astrocytoma cells, while protecting normal brain cells from death through activation of adenosine monophosphate kinase, AMPK. Tumors possess abnormal vasculature which blocks adequate tissue perfusion, leading to the presence of hypoxic regions that promote chemotherapy and radiation resistance. In fact, hypoxic cancer cells are 3 times more resistant to radiation therapy than are well-oxygenated cells. In addition to decreasing the efficacy of standard care, tumor hypoxia activates a number of oncogene pathways, largely through the HIF-1 transcription factor, which promote tumor growth, metastasis, angiogenesis, and inhibit apoptosis. Hyperbaric oxygen therapy, HBOT, involves administration of 100% oxygen at elevated pressure, greater than sea level, or 1 atm. HBOT increases plasma oxygen saturation, which facilitates oxygen delivery to the tissue independent of hemoglobin oxygen saturation. The potential benefit of using HBOT to combat the cancer-promoting effects of tumor hypoxia is clear. HBOT alone has been shown to inhibit tumor growth, reduce tumor blood vessel density, and induce the preferential expression of anti-cancer genes in rat models of mammary tumors. Additionally, radiation and many chemotherapy drugs work by producing free radicals within the tumors, leading to cell death. HBOT enhances tumor cell production of reactive oxygen species, which contributes to the synergistic effects of HBOT as an adjuvant treatment to standard care. Indeed, HBOT enhances the efficacy of both radiation and chemotherapy in animal models. In normal tissues, decreased oxygen availability inhibits mitochondrial production of ATP, stimulating an upregulation of glycolytic enzymes to meet energy needs by substrate-level phosphorylation production of ATP. Thus, the cellular response to tumor hypoxia is mediated by several of the same pathways that are overly active in cancer cells with mitochondrial damage and high rates of aerobic glycolysis. This suggests that the ketogenic diet and HBOT could target several overlapping pathways and tumorigenic behaviors of cancer cells. We hypothesized that these treatments would work synergistically to inhibit tumor progression. We suggest that the addition of these non-toxic adjuvant therapies to the current standard of care may improve progression-free survival in patients with advanced metastatic disease. Materials and methods. Mice. 3 breeding pairs of the VM-DK strain of mice were used to establish and propagate a VM-DK mouse colony. 40 adult male mice, 10 to 18 weeks of age, were used for this study. Subcutaneous tumor implantation. On day 0, VMM3, flux cells, 1 million cells in 300 milliliters PBS, were implanted into the abdomen of VM-DK mice. Inoculation results in rapid and systemic metastasis to most major organs, namely liver, kidneys, spleen, lungs, and brain. Diet therapy. On the day of tumor inoculation, mice were randomly assigned to one of 4 groups: standard diet, control, standard diet plus HBOT, ketogenic diet, or ketogenic diet plus HBOT. Mice in the standard diet group were fed standard rodent chow ad libitum. Mice in the ketogenic group received KD Solace ketogenic diet ad libitum as well. Hyperbaric oxygen therapy, HBOT. Mice undergoing HBOT received 100% oxygen for 90 minutes at 1.5 atm gauge, 2.5 atm absolute, 3 times per week, Monday, Wednesday, Friday, in a hyperbaric chamber. Bioluminescent imaging and tumor growth analysis. Tumor growth was monitored as a measure of bioluminescent signaling. Approximately 15 minutes prior to in vivo imaging, the mice received an injection of D-luciferin. As only the cancer cells contain the luciferase gene, bioluminescent signal, photons per second, of the whole animal was measured and tracked over time as an indicator of metastatic tumor size and spread. Statistics. Correlation between blood glucose, body weight change, and survival times were analyzed by linear regression analysis. Results were considered significant when p was greater than 0.05. Results. Combining the ketogenic diet with HBOT prolonged survival in mice with metastatic cancer. Ketogenic diet and ketogenic diet plus HBOT treated mice demonstrated a statistically different survival curve by log-rank test with an increase in survival time compared to control animals. Ketogenic diet fed and ketogenic diet plus HBOT animals also showed a significant increase in mean survival time compared to control animals. Although previous studies have reported that HBOT alone can increase survival time in animals with various cancers, we did not see an effect on survival in mice receiving standard diet plus HBOT. The ketogenic diet alone increased mean survival time by approximately 17 days, 56.7%, and when combined with HBOT, mice exhibited an increase in mean survival time of approximately 24 days, 77.9%. Figure 1b. This finding strongly supports the efficacy of the ketogenic diet and HBOT as therapies to inhibit tumor progression and prolong survival in animals with metastatic cancer. Figure 1. The ketogenic diet and hyperbaric oxygen therapy increases survival time in mice with systemic metastatic cancer. Figure 1b. Treatment group cohort size and mean survival times. Ketogenic diet mice exhibited a 56.7% increase in mean survival time compared to controls. And ketogenic diet plus HBOT mice exhibited a 77.9% increase in mean survival time compared to controls. The ketogenic diet and HBOT decreased tumor bioluminescence. Bioluminescence signal was tracked as a measure of tumor size throughout the study. Animals receiving the ketogenic diet alone or in combination with HBOT demonstrated a notable trend of slower tumor growth over time. This trend was more pronounced in ketogenic diet plus HBOT mice and reflected the increase in survival time seen in these animals. See figures 1 and 2. Figure 2. Tumor bioluminescence in mice. Tumor growth was slower in mice fed the ketogenic diet than in mice fed the standard diet. Figure 2a. Representative animals from each treatment group demonstrating tumor bioluminescence at day 21 after tumor cell inoculation. Treated animals showed less bioluminescence than controls with ketogenic diet plus HBOT mice exhibiting a profound decrease in tumor bioluminescence compared to all groups. Figure 2b. Total body bioluminescence was measured weekly as a measure of tumor size. Ketogenic diet plus HBOT mice exhibited significantly less tumor bioluminescence than control animals at week 3, and an overall trend of notably slower tumor growth than controls and other treated animals throughout the study. The ketogenic diet lowered blood glucose, elevated blood ketones, and decreased body weight. Prior to the study, initial blood glucose, ketone, and body weights were similar among the groups. Blood glucose levels were lower in the ketogenic diet-treated mice than in the standard diet-treated mice by day 7. By day 7, ketogenic diet-fed mice lost approximately 10% of their initial body weight and maintained that weight for the duration of the study. Day 7 blood glucose and percent body weight change were significantly correlated to survival time. Figure 5a. Glucose levels are correlated to survival. Linear regression analysis revealed a significant correlation between day 7 blood glucose with survival. Discussion. Nearly a century after Otto Warburg reported the abnormal energy metabolism of cancer cells, renewed interest in the field has elucidated a plethora of novel therapeutic targets. Two promising treatments involve the use of HBOT to reverse the cancer-promoting effects of tumor hypoxia and the use of the ketogenic diet to limit the availability of glycolytic substrates to glucose-addicted cancer cells. Both therapies have been previously reported to possess anti-cancer effects. Since these treatments are believed to work by targeting several overlapping mechanisms, we hypothesized that combining these non-toxic treatments would provide a powerful, synergistic anti-cancer effect. Furthermore, since metastasis is responsible for the overwhelming majority of cancer-related deaths, we tested the efficacy of these conjoined therapies on the VMM3 mouse model of metastatic cancer. We found that the ketogenic diet, fed ad libitum, significantly increased mean survival time in mice with metastatic cancer. Figure 1. It is important to note that ketogenic diet-fed animals lost approximately 10% of their body weight over the course of the study. Figure 4. As calorie restriction is known to elicit profound anti-cancer effects, the ketogenic diet may inhibit cancer progression in part by indirect dietary energy restriction. Fine and colleagues recently used a very low-carbohydrate ketogenic diet to promote stable disease or partial remission in patients with advanced metastatic cancer. Fine's study demonstrated a correlation between blood ketones and response to the diet therapy, suggesting that ketone elevation itself also contributes to the anti-cancer efficacy of the ketogenic diet. As hypothesized, profound anti-cancer effects were observed in our metastatic mouse model after combining the ketogenic diet with HBOT. Combining these therapies nearly doubled survival time in mice with metastatic cancer, increasing mean survival time by 24 days compared to control animals. Figure 1. The ketogenic diet plus HBOT-treated mice exhibited significantly decreased bioluminescence compared to controls at week 3, and a trend of decreased tumor growth rate throughout the study. Figure 2. By day 7, all animals on a ketogenic diet had significantly lower blood glucose levels than controls. As it has been shown that tumor growth is directly correlated to blood glucose levels, this decrease in blood glucose concentration likely contributed to the trend of decreased tumor bioluminescence and rate of tumor growth seen in ketogenic diet-fed animals. Nabling et al. Demonstrated that the ketogenic diet significantly decreased glucose uptake in pediatric brain tumor patients by FDG PET analysis. This clinical data suggests decreased glucose delivery to the tumor is a causal mechanism in ketogenic diet treatment. As ketones are metabolized exclusively within the mitochondria, cancer cells with damaged mitochondria are unable to adequately use them for energy. Many cancers do not express the SCOT enzyme which is required for ketone body metabolism. Furthermore, ketone bodies have anti-cancer effects themselves, possibly through inhibition of glycolytic enzymes. HBOT increases reactive oxygen species production within the cell, ROS, which can lead to membrane lipid peroxidation and cell death. Cancer cells with mitochondrial damage and chaotic perfusion naturally produce chronically elevated levels of ROS but are susceptible to oxidative damage-induced cell death with even modest increases in ROS. We propose a potential mechanism of ketogenic diet plus HBOT efficacy. The ketogenic diet weakens cancer cells by glucose restriction and the inherent anti-cancer effects of ketone bodies, while simultaneously conferring a protective advantage to the healthy tissue capable of ketone metabolism. This metabolic targeting sensitizes the cancer cells to HBOT-induced ROS production and oxidative damage, contributing to the efficacy of combining ketogenic diet with HBOT. Additionally, ketone metabolism by the healthy tissues likely confers protection against the potential negative consequences of HBOT, CNS oxygen toxicity. In our present study, HBOT alone did not improve the outcome of VM mice with metastatic cancer, but combining HBOT with a ketogenic diet elicited a dramatic therapeutic effect. It is important to look for synergistic interactions between therapies which may increase the efficacy of cancer treatment. Scheck and coworkers reported complete remission without recurrence in 9 of 11 mice with glioma by combining the ketogenic diet with radiation. Marsh et al. Reported synergy between the restricted ketogenic diet and the glycolysis inhibitor 2-deoxyglucose. Might adding HBOT to these combination therapies elicit even better results? Similarly, might the use of adjuvant therapies like ketogenic diet and HBOT enhance patient response to standard care? Our study strongly suggests that combining a ketogenic diet with hyperbaric oxygen therapy may be an effective non-toxic therapy for the treatment of metastatic cancer. The efficacy of combining these non-toxic treatments should be further studied to determine their potential for clinical use. Based on the reported evidence, it is highly likely that these therapies would not only contribute to cancer treatment on their own, but might also enhance the efficacy of current standard of care and improve the outcome of patients with metastatic disease.